Hello everybody and welcome to the Thursday edition of Video Clips. And before I get into today's topics, remember that on the 25th of February is part 2 of the Advanced Study Program on Whole, Rethinking the Science of Nutrition. And this is the program where I provide you with slides. It's a 2-hour interactive conference call where you get a chance to ask questions and you get, like I said, the slides so that you don't have to take notes fast and furious. And if you've read the book, it'll help you understand more about it. And if you haven't read the book, it might inspire you to, or it will at least give you working knowledge of the concepts in the book. And then on the 26th of February is the next Introduction to Plant-Based Nutrition, which is the action-packed 90 minutes, science and skills, get you off to a quick start to begin changing your diet. So contact our office if you're interested in that stuff. Okay. I want to talk about a couple of issues pertaining to the practice of medicine today. And I'll just start by saying one of the shortcomings, I think, of modern medicine in westernized countries is the fascination with things that are new and technical. If it's new, if it involves complicated technology, and particularly if it's expensive, it must be better. That's the prevailing attitude. While there's no question that that's true in some cases, in most it's not. And I've been talking about the inadvisability of colonoscopy for many populations for some time, and I think this study adds to the body of evidence that supports what I've been saying. So a new study shows that fecal immunochemical test, or FIT, it's a home stool test that requires no liquids to clean out the colon, no sedatives, no anesthesia, no procedures in a doctor's office, and virtually no risk. And this is quite a contrast to what goes on when you have colonoscopy. It's effective in diagnosing 79% of colorectal cancers, and the difference in cost and accessibility is absolutely huge. According to this meta-analysis, which included 19 studies, 2 of the most well-researched brands of FITs are both sensitive and very specific. The analysis showed that FIT detects almost 4 in 5 cancers with a single test. The researchers concluded, and this is a direct quote from the study, this systematic review and meta-analysis suggests that FITs have high accuracy, high specificity, and moderately high sensitivity for the detection of colorectal cancer. Now, I've written a lot of articles on the risks and limitations associated with colonoscopy. They should be considered before having the test. Now, in spite of aggressive promotion, health authorities estimate that at least 1/3 of adults have not been screened for colorectal cancer. I'm one of those people. Access is an issue for some, expense for many, but justifiable dread of the procedure and concern about the risks is another huge deterrent. The results of this analysis suggest that the FIT test is a viable alternative for those who want to be tested but don't want to subject themselves to the risks associated with colonoscopy. So again, sometimes the low-tech option is the better option. All right, the next thing I want to talk about is a follow-up to a newsletter article that I did just a couple weeks ago. The low T craze and the prescribing of testosterone to men to cure it has just created this multi-billion-dollar frenzy of an industry for drug companies and enterprising docs who promise that symptoms ranging from just general fatigue to lack of athletic prowess can be cured by taking hormones. And, I guess I look at this after failing miserably to show safety and efficacy for HRT for women. Now we're focusing on men. So isn't equal opportunity a great thing? Well, in a recent newsletter article, as I mentioned, I highlighted the inaccuracy of testing for testosterone levels and the lack of evidence supporting the claims made, as well as the risks associated with taking testosterone. I predicted in the article that many new studies will show that taking this therapy is a terrible idea. And indeed, shortly after the newsletter article was published, along came a new study, not the only one, just a new one right away, that showed that testosterone can be problematic. This particular study showed that testosterone therapy increased the risk of heart attacks in middle-aged and older men with a history of heart disease. It's not the first study, as I mentioned before, that has shown this result. A major issue, and I think this is what bothers me about so much of the stuff, is many of the risks associated with testosterone are not listed on the label, and they're not certainly reviewed by a doctor with a patient before testosterone is prescribed. And I think at the very least, men should be given a list of the potential side effects of testosterone before being given a prescription. And this informed consent discussion about the risks associated with drugs and supplements and procedures, it's not going on. It's one of the things I'm going to keep ranting and raving about until it does go on everywhere. Well, to get back to what did this study say? The study was funded by the National Institutes of Health. It involved close to 56,000 middle-aged and older men who were taking testosterone and looked at the incidence of heart attacks in the year before they started taking the drug and then in the months following. Men 65 years of age and older, and men younger than 65 with a history of heart disease, had double the incidence of heart attacks after starting testosterone. Risks were not increased for younger men with no history of heart disease who were taking the testosterone. Now, there are several potential reasons for this increased risk, and in fact, the researchers looked at the possibility of one, which is that it could be increased aggressive sexual activity, since that's, increases in libido is one of the reasons why men ask for the testosterone replacement. However, a comparison of men taking testosterone with men using drugs like Viagra or Cialis showed that the drugs didn't increase the risk of heart attack. Testosterone clearly did. Now, I'm sure testosterone therapy increases the risk of many diseases. Studies certainly showed that that was the case for women taking HRT. In the case of men, and I think this was also true of women, there are risks associated with the hormones themselves, but also risks associated with taking the focus off of why both men and women want to take hormones in the first place, which is there are underlying issues that need to be addressed. In the case of men, conditions like obesity, diabetes, high alcohol consumption, lower testosterone levels, and they by themselves are risks for heart attacks and coronary artery disease. So the best approach for men, if they want higher testosterone levels and they don't want to have heart attacks, is convert to an optimal diet like the one we teach here at the Wellness Forum. Your testosterone levels will go up, you'll reduce your risk of coronary events, and there are no negative side effects, only positive effects from using these strategies. So that's all for now, and actually for the week. Have a wonderful weekend, and I'll be back to you again on Tuesday. As usual, pass this on to anybody who you think might enjoy watching it.